me before. So for those of you I haven't met, I'm Candy Loeb. I'm the interim HRPP director for Dartmouth-Hitchcock. Jocelyn Isley is our interim IRB coordinator. And so the purpose of today's demo is to show you how the multi-site study functionality works when Dartmouth-Hitchcock is the lead site or lead IRB. Okay? So the first thing that I'm going to do is log in as the PI and actually create the new study in the scenario. Because it's behind me, if you guys can't see something or you need to stop and ask questions, just please shout it out and let me know. Okay, so this is my inbox as the PI. Everything that shows on this screen are things that I have an action to take. So I have a lot of studies that are in pre-submission. But right now what I'm going to do is actually create a new study. So collecting the same basic study information that you're used to providing. So we'll say DH as sIRB for multi-site trial. MSS, DH as sIRB, NCC study, Aaron did a great job. Picking on you guys in the audience. Got to make it somewhat fun, right? Okay, so this question 4 might be a little bit different than what you're used to seeing in report. And so what it's asking you is tell us what type of study it is, either collaborative or multi-site or a single site study. So what you decide here actually changes your experience with the SMART forms. So if you say single site, it's just going to walk you through what you're normally used to. If we select multi-site or collaborative, which is what we're going to do, it's going to add some new SMART form pages for you guys. Will an external IRB act as the IRB of record? In this case, we'll say no because we're going to have DH be the IRB of record for this study. So the lead
said yes.
Thank you. You guys are really good. All right. So I said no, and then will your IRB act as the single IRB of record for other participating sites? And this is where we'll say yes. And this also gives us some new SMART forms. So the local principal investigator, it defaults as me. I'm the person logged in creating the study. So if you're the PI, great, you can leave it. If you're not, then make sure to change it to who the PI is. And then does the local principal investigator have a financial interest related to the research? And I would say no. If I did, I would say yes. And now I need to attach the protocol. You can use drag and drop functionality here, but what I will do is just attach from some of the documents that I have. We'll use our template protocol. Say okay. All right. So finish everything I needed to complete on that page. And so one thing I like to point out, and I know you have this in rapport, but now you can see all the different SMART form pages we'll need to complete related to the study if I select the Jump To button. So study funding sources, just like before, you can add any funding you have here. If you use the wild card, you can search. I was trying to find NIH, but there's other ones, so we'll just go with that. You can enter this funding ID, the grants office ID, and add any files related. Say okay. Continue. Local study team members. So one thing that I like to prompt for when we're doing this is before you used to just see study team members. Now, because this newer version of the system will allow you to enter things about your participating sites. You're going to start to see differences between like local versus study. And what we don't want to include in your local study team members are any of your collaborators. We really want this to be just the people that are at DH that are working on the study.
Good question.
Yes.
Dartmouth and DH.
Yes, that's right. We're going to treat everybody. Yeah, that's right. All of them will be in the system and available in that selector list. So yes, yeah. Thanks for clarifying.
Say Manchester, you still study team.
They're still under our oversight. So yes. Okay. So, like I said, the selector list. So everybody who's in rapport right now, we'll bring over. So we'll just add, we'll add Daniel, why not? Say, okay. I need to move this guy, he's gonna get in my way. Okay, so then their role in the research. What I will say is that we did take the roles that were in rapport. So this is just a test site, and those will be updated to reflect the roles that you're used to using. So we'll say Daniel is a co-investigator. Is he involved in the consent process? Sure. And does this study team member have a financial interest related to the research? I'll just say no. I can hit OK and add another and keep adding people. If you say OK, you can still add people. Just might be easier to say OK and add another. External team information. Again, I like to point out that's not for your collaborators. So think of those as maybe, this happens a little bit more in, well, I guess maybe if you had, no, I mean, I start to think of this as like if you have in community-based participatory research, these are individuals that really aren't affiliated with any other institution, and so we're going to have to execute an authorization agreement to bring them in under our oversight. So I don't know how frequent that really is here, but that's not meant to include the collaborators, and I'll show you where we add them in just a minute. Yeah.
This may be such a weird case of answer. We're on the breast cancer trial. We do have external sites signed up. Trials on hold right now. One example of an external site is St. Joe's Hospital in Nashua. They're their own site, and yet the surgeon who operated, we found this out kind of almost by accident. The surgeon who operated was actually DH Nashua, the surgeon, so just within DH.
Yeah.
But he did the operation there, and it came up as a question if they didn't know how to invoice for his services because he had operating privileges at that hospital, but was actually a DH person. So would we put him on the local study team?
So, yeah, that's tricky because he's technically working at an external site, but he is a DH employee. And so by nature of him being a DH employee, we can provide IRB oversight for him, but that site, the engagement of that site creates some additional things for us to consider. So
Maybe
yeah, I mean, I would say we might even have to think through some additional things that go along with that, but gut instinct, I would say no, he'd be a local study team member because he's us, but he was in that institution that we're not responsible for. So it creates a little bit of a wrinkle. Yeah.
That's very common in the Southern region, actually, that you have DH agents who work in other institutions.
Yeah. Yeah.
So it comes out actually.
Yeah, so this is one of the things that as we started to even file our FWA and like try to figure out who we actually do have oversight for and who we don't, and you saw some emails this week, Aaron, I think there's going to be further refinements because here's the thing that we don't want to see happen is we don't want to assume that investigator is covered by our IRB and they really weren't. And that means they're actually conducting research. It's not compliant, right, with the paperwork that needs to be filed, even though there's IRB approval in place. That's where it starts to get really messy and convoluted. And I think even over the next 6 months to a year, we're going to see further refinements to how we're defining people. And we may have to do some changes to our paperwork as well. So, in that situation, corner case, most of the time this should be Dartmouth-Hitchcock is who we're going to include in the local study team members. So study scope, this is what's going to prompt us for what additional about the study we need to know. So it's going to ask us if there's drugs or devices. You guys have seen these pages before, so I'll just say yes to drugs and no to devices, just in the interest of time.
I have a question back to the external study team members. Do we only, so for these external sites, you don't have to put the PI as an external team member?
This is not where we talk about your collaborators.
Oh, okay.
Let's wait till
Okay.
we get to that. Yep. So what's new, and I can give you a spoiler alert, but it's kind of difficult to think about in the abstract when we walk through it, but what's new in this system is that we now have what's called a site record. Now there's going to be a specific place, a specific record tied to this study, but where it's all the information about your participating site. And each site will have its own record. Okay, so we'll get there. Okay. So yeah, we were at the local research locations. So here is where we would add any of the DH sites. So we have our list here where research might be conducted. We'll say Keene. Just like in rapport, if something that you're looking for isn't there, you can add it. But again, because this is supposed to be local locations, it really should be on that list. So if we start to see things coming through on this list that really shouldn't be there, we're gonna try to figure out what's going on. But this list matches the list that's in rapport currently for that. So, okay, so we added Keene. Drugs or biologics, so adding the drugs. And we're bringing over the same drug and device list from rapport. So you guys won't lose anything there. And then you can attach any files related to the drug. Same functionality for devices. They're an IND. If we say yes, it's going to have me identify each IND. And say who holds it, the sponsor and the investigator. If they're one and the same, what I like to say is you can select other and just say sponsor and is investigator, vice versa. And then attach any files that are related to the drug. Study-related documents. So because we are the lead site, I would anticipate that we have a template consent form, we have template recruitment materials, we have templates that we're going to expect our participating sites to use. We have to approve those as the IRB of record. So that's what we want to see loaded in the study-related documents tab. So we'll say template consent. And then, your recruitment, and then anything else you want to attach that's study specific. So the local site documents, this is where I would expect to see your study team's version of the consent form that will be used at each. So we have the template. Now we have the DH version of the consent form. We also would have the DH version of the recruitment materials, and then the DH version of anything else that might be specific to this location. So basic study smart form, you've just answered some questions in a way that triggers us to answer some different things. So I'm going to go ahead and say finish. So the next step is we're going to manage our participating sites. And that's this activity over here. Okay. So you can see here it's referencing an institutional profile. If I take a step back, any sites currently that are participating sites or even lead sites that are in rapport are being loaded into our institutional profile because we know somewhere along the line there was an agreement in place, research is happening with that site. So they'll exist in the system and become available to select when I select add. So in my test system, I only have a couple here, so I'll select Northwestern. And the principal investigators, so here's where we want who their PI is. So anybody who's been in rapport and added their PIs there, those PIs will still be in our system. And so I'll just select one here. Yeah.
How do you add a brand new person?
You'll have to call us. So same with an institution or a person, you'll have to call us and let us know. And part of the reason that is because that triggers us to tell us maybe haven't worked with them before and we maybe don't have the right agreement. That'll prompt our conversation, say, hey, actually we have to start the agreement process. The nice thing is you can still submit your study and let it get approved. The site not being set up fully won't prevent your study. But that gives us in the IRB the time to work out those agreements. Okay. So another difference you guys will see here is that we have a sites tab. And so you can see it's telling you it's not created yet, but you're telling me Northwestern might be involved in this study. So at this point, what I would do is I would go, well, I don't have to go back anywhere, but I can move my study to I can submit to the IRB. You can add multiple sites. So if you already know you have 5 sites you're going to be working with in the project, you can do that. Okay, so now it's in the pre-submission state, and I will log off and log in as the IRB coordinator because I want you guys to see what happens next as far as how we move the site through as well as the study. Okay, so I have the study here in my inbox. And so what I would do is I would do my pre-review, I'd look at the study, I'd also see that we have a sites tab. Probably your study materials are telling me this is a multi-site study, so it's going to prompt me to look. Whoops, sorry, I have to sign myself as a coordinator first. Okay. So at this point, I can submit my pre-review. I can also manage participating sites. So if you guys sent this in to me and you said, oh, I've got another site, I can add it here for you if that's the case. All right, so I'll submit my pre-review. Part of the boring we do have to walk through together is just seeing what we do. So I'll say the FDA is involved. We'll say that there's pregnant women. And it's biomedical. And it's collaborative. And we'll say yes. Part of the reason why you guys are asked to answer the question of why it's multi-site or collaborative is because it's just going to set up the smart forms or work the way that they need to for you. The reason I'm asked the question is because we might be able to, I don't want to say this in a bad way, but it matters for our tracking purposes. So if you selected wrong in your study smart form, we can just make sure we select it right here. So you might say multi-site because you have 2 sites involved, but really everybody's doing the same thing. So it's a collaborative study. It's just a tracking thing for us. It doesn't change anything about what you told us. So we'll go ahead and submit. So what's happening right now is different in the system, and it actually just created your site record because I submitted the pre-review. Before, what used to happen is you answered your questions in a certain way, and it meant that's the truth forever. So if you said multi-site and it wasn't, and it created all sorts of habits. So now your site record is created after we're able to say, oh yeah, this looks good and all makes sense. So now when I select the site, I'll go in to the site here. And what's happening is now we have the site record. This is different, right? So now there's an actual workflow for this site. The one thing that I'll say is that for everything to get totally wrapped up for the site, we need the study to get fully approved. Clearly, we don't want to have, let's say, documents from Northwestern at this point based on the consent template that wasn't being approved yet, because now we're going to have all sorts of changes happening in the study. So ideally, what we want to do is get the study into the study state and then work on the site. But the first thing that I would do with this site is take a look at it and say, oh yeah, this site, you know, we have all our agreements in place. There's nothing about it that we wouldn't take on oversight for this. So we'll go ahead and submit the invitation decision. And we say, yes, this site can participate in this study. If I had any supporting documents, I could add them here.
So it's you guys that have to make the site record? Like,
You did initiate the record by telling us when you managed your participating site, you started the very basic part of it, right? It doesn't actually exist in the system until our office can say at the time of pre-review that yes, this is actually a multi-site or collaborative study, and then that site record exists. So because there was a state change that went from invitation pending to a waiting site, you guys just got an email that said, we've accepted Northwestern as a participating site. What that does for you is make now this site record editable to you so you can start to tell me more information about this site. So I'm actually going to do that. I'm going to bounce back as the PI. So if I go into the IRB, now I have this tab for external IRB. So those are my studies where we're relying on an external IRB. And then I have relying sites. And these are my participating sites.
That's fine.
So my site is here, and it's telling me we're awaiting site material,
Whatever works for you guys.
which makes sense because your templates and your study hasn't even been approved yet, right?
yeah.
But we're pretending while the IRB is reviewing,
Hello.
you guys can start.
Really careful.
And so the first thing you would want to do is edit the site.
I never got a location specific.
So it automatically creates a short title for the site, and what it does is tell us this site is a participating site for this study. You guys can change it, but that actually might be the easiest thing to have in there, just because it's pretty explicit. Now, does the local investigator have a financial interest related to the research? This now means the PI at Northwestern. It's not a required field. You guys might not know. But if you know, you need to know. and it's because it matters when it comes to those
I
discussions.
can, very nicely. No, actually, don't turn it. It's better before. It's all about the glare.
Yeah.
So I'll just say no. And then brief description of all activities the site will perform. So if this is truly a collaborative study, and you're doing, sorry, a truly a multi-site study, and you're doing
This
everything
one 100% needs
as
to
described.
The tip behind it is in a difficult.
A study with multiple arms, and maybe they're only participating in one component.
Yeah.
That's just what I want you to tell us
No,
here.
I
That
can
you're
try
doing something
to get
different than everything in the study. So you can say Northwestern
You might have to refer that one out.
That is that one,
only
I mean, I realize
arm
it's not in
one
my house.
as a trial.
That one also is that.
So it doesn't have to be
Appears
a big deal. We just want to know if it's different.
The one in front of it seems to be worse.
So if there's any funding for this local site that's different,
And it's
not required, but if there is, you can add it here.
Continue to be a difficult to clean.
The local site documents. So again, probably don't have it because the study really isn't approved yet, but once the study's approved and they've had the ability to work on those templates, this is where you would add their consent form.
But you said you're not quite up for it yet. So we'll have to find another time.
Also their local recruitment materials or anything else that they're going to use locally.
Well,
I was told we had 2 weeks to do that.
this is where.
That's it. That's the final page. And so what that is meant to do is that's just a shorter version of the study smart forms, but it's just specific to your site because we don't anticipate that anything's really different. It's just they have specific materials they're using that we have to review and approve. So what I would do now as the DH study team is submit the site material.
Could then be done with a lot less system.
So any comments you want to add here, you can.
Normally you want.
Say okay. This will be turned off in your system. You won't have to do this.
Even, and I think the first treatment will, probability.
And so now your site moves into pre-review. So what I'll do,
It's all,
log off really quick. Log in as the IRB.
yeah, but it looks a little like
Yeah.
Okay. So now you guys can see me as the IRB staff. I have this site that needs me to do something with it. So I can assign it for review. One thing I like to point out too for you all as study team members is that if the study needs to go to a convened meeting, the addition of a site does not. So we can add participating sites unless they're doing something else in addition, which doesn't really happen, right? That would be greater than minimal risk. But assuming that the study was approved, this now can just be reviewed by somebody in the office who's an IRB member, and we can keep the process moving. So I don't want you to panic like this is going to be another convened full board review just to get them on the study. Any notes? Oh, sorry. This is my process. You guys don't need to worry about
So
it.
we don't need to attach, so what we've done previously is for the PI of these external sites, we said that, this is PI, and then we also included in a supporting document, the HSP certification of the PI. Do you still need that, or? HSP certification. Yeah. It's just their human subject protection training.
Oh, training.
Yeah.
Yeah, no, you can provide it. I think one of the things we want to start doing is it's really on the PIs to say that my team is ready. And part of what the PI is doing, what our investigator manual says, that we realize part of it is that I'm a PI, I take full responsibility for everybody on the study. So it's really on PI to attest to that. we're tracking all of your training that we have access to in city. But ultimately, we're really kind of going to move towards putting that on guides. And the other thing is that their local IRB, I don't know what their training requirements are. So then what? Like I can't, you know, if they're coming to our IRB, but they might have some training requirements that don't even match what we're doing. So I think for the time being, sure, go ahead and give it to us. We just might see that process refine in the month to come. Okay. We added Northwestern as a participating site. I did my pre-review. One of the things you guys will notice is I don't have that loop that I normally would at pre-review to talk to that site because I can't, right? So I would just be talking to you guys. So we just don't do that. If there's something about your P site that doesn't look right, I'm probably just gonna get on the phone with you guys and say what's going on. And then I can even edit the site or maybe have to send it back to you guys if something isn't right. But I can't request clarification because there's not a PI for me to talk to at their site yet. So then we just submit the site designated review, get it to approved. And the reason this is grayed out is because I can't approve your site before your study's approved. Your study isn't approved yet. I didn't do that yet. It's okay for the purposes of this. I think you guys just see the difference between the study and the site record. And I have something approved already, so that's just what I'll move into. Any questions? Okay. I'm going to tell you guys one little thing. The reason we made the switch to make it a study and site record is because there is now what's called the exchange. And the goal is that we're going to have participating sites that can use the exchange, with the end goal being your participating site without getting access to your system. So we're trying to build that up so that it's not going to be on the research coordinators or the study teams to enter that information about key sites. It really could be that your site record exists and they have a web interface that they can go to and just enter these data points, and it'll ping you guys to let you know that it's done, rather than having you guys have to keep maintaining it. So that's ultimately where we're going with this. So I just wanted to give you sort of a heads up of why this change was made. It really was after the NIH put in the mandate for multi-site studies that we're like, well, study teams aren't going to be able to manage this across the board, so maybe this will make it easier. So this is step one to making it easier. Okay, great. So we talked through submitting your study as a multi-site study where Dartmouth is the lead. We added our participating site, and essentially we've got it through to approval. So the next thing I want to do is just log off, and I'll log back in as the PI. And so what I want to do is I want to go to my relying sites. And so here I have one where Northwestern is already active. So if I just go back to the study, bless you. My study is approved. I'm the lead PI at DH. And so now I have a site modification that I need to submit to the IRB. So maybe something about the study overall isn't changing, but let's say there's something specific at that site is changing. Sometimes I think they have a change in PI. Sometimes it could be that after we've reviewed and approved everything, their local IRB has come back and said, actually, you need to do X, Y, and Z to your consent form. So it's not impacting your study, but it's impacting the site. So what we want to do is get that modification in for the site. So what I would do is select the site, and now I already have a mod opened on this. Let's go to this modification. All right. So let's just walk through this. I'm sorry, I had submitted this last night, getting a little bit eager for the demo. So when I submit the modification, it's going to ask me, what about this site are you changing? And so it's going to ask you, just like you do in your modifications now, it's either going to be the study team or other parts of the site. So in this one, I believe I said other parts of the site. So what's the enrollment status at that site? Will we notify subjects? Any summary of the modifications? So what I'm saying is there was a change in local study procedures and they updated their consent form. Go ahead and continue. So that means all of your smart form page is unlocked and I can make any changes that I need to make. Can add any additional funding. And then we uploaded a new version of the consent form. So again, you can't edit the study, you can only edit the site with this type of modification. So I'll go ahead and exit. And so this has already been submitted to the IRB, that's why it's in pre-review, but otherwise you would say submit site modification. You do have the option here to correspond with the site. So the way that that works is that because we have the email addresses of the PI in the system, you could actually send them an email right here. Now they're not going to be able to respond to you in the system, but if for some reason you want to go log in and send them an email from the system, you could do that. So we've submitted it. It's in pre-review. If I log back in as the IRB coordinator, the site mod should be in review. No, we'll do this. Do it. Well, if it's in pre-review, it should be in my inbox. I think I just have a lot of things in my inbox, so I'm trying to find it quickly. Okay, so here we go. So modification 1. So it's in pre-review. I can assign it to a designated reviewer or I can assign it to a meeting. So chances are, I mean, if you have a site on minor change, you can review it by expedited procedure. But if there are changes that are above minor modification, we would have to send it to a meeting. But we have either option. I'm just going to assign it to designated review for the interest of time. Say okay. Now it's in IRB review. If I submit the designated review, I just want to point out that we can actually go through a modifications required loop. What'll happen is that if the board decides that modifications are required, or if the designated reviewer decides that, what has to happen, and probably what you guys are already used to doing, is it has to go back through to you guys to tell them what changes are required. And then once you get that back, you can send it back to us. So I will say that. Update consent. Say okay. Okay. So at this point, the site designated review is submitted, and so I can prepare the letter. So it'll be similar. Oh, I always forget to hit generate for whatever reason. So it'll be similar to when you guys receive a modifications required letter now. It's just going to be really specific that this is to your site instead of your study. Do it. All right, we'll try this one. Say okay. We'll send it to get it back to modifications required. So just in the interest of time, I'm not going to walk through that response loop. It operates very similar to what you would do when responding to modifications required. What I really do want to do is show you, if I log back out and I log in as the PI, just want to talk to you a little bit about continuing review. So if I go to my relying sites again, let's see, who else do I have active? Let's try this one. Okay. So if I go to this study, I want to create my continuing review as you normally would. And you always start the continuing review on the study. You're reporting the continuing review for the study. Who was talking about meditation earlier? Okay, so the first thing that it's going to ask for is what we normally provide in our continuing review form. So it's asking us about enrollment. So I'll say we had 10 subjects enrolled this year, total since last approval, so that's since last CR, so still 10. Study-wide, well, I'll say 10, and one of the things it's cluing you into right here is that you have one participating site, and none of them have given you any data about their enrollment yet. So we know that we're not really ready to submit this continuing review. It's asking us for the research milestones. Does the investigators or research staff have any conflicts of interest that we need to know about that we didn't know about before? Now we're making sure that all the following are true since since initial approval or continuing review. Yes. Oh yeah, thanks. Oh, good question. I don't know if you guys all heard that. So will a consent form from relying sites have a different renewal date from the from the study? The answer would be no. So the study can only be approved for 1 year. That includes any site. So if you get a site approved the month before the study expires, they've got to get a new consent form. So the approval dates are always related, and expiration dates are always related to the study, not the site. You can attach any supporting documents. So during our sessions this week, what came out of the discussion was you all would like a template that helps you add a supporting document here. And basically what we want in this is brief description of progress to date, and then an explanation of any of those items above that you couldn't affirm. And so we created the template, and that'll be live within a couple of days. So you can add any supporting documents. And that's it. That's all you have to tell us for continuing review. You can submit. So one thing we did that we wanted to make sure of was, if you have a bad egg participating site, you can still submit your continuing review even if they haven't sent in their information. We don't want the study to lapse because of a bad actor, right?
So is this assuming that the sites their system
Sites cannot get into the system.
Yeah.
They still have to tell you.
Okay, so they have to tell me, and then I have to go in and put that
That's right.
to the site.
So right now, yeah, well, yeah, I mean, yes. So you'll have their specific site records. So let's say you have 10 sites. You can update Northwestern's, you can update Duke, you can update I don't know, any other collaborator. Emory, you're working with Emory, all right? So you can update Emory's record. Yep. So now what I would do is, yeah. No, so you can't renew a site, you can only renew a study. So a study has to be renewed. Good questions, Nancy. All right. So now this is where it starts to look a little different than what we're used to in the system. So we have our site here. And this, I think it looks like a play button. I don't know what else to call it. Is where we need to report our continuing review data. So I selected that button. It's linking you to different things you can do with the site, but right now what I want to do is report the continuing review data. Just taking you back to really the same screen, but now you're telling us enrollment for this site. So we'll say 10. Oh, I think I said 10 last time. Let's do 5. 5. Make sure everything's true. If not, and they had something that didn't work out right or something has been going on in that site, you don't have to check all those boxes and you can add the supporting document for them. What I can recommend is that because we've created the template for this, if you know they've already said no or can't say yes to one or more of those boxes, send them the form and let them fill it out for you. That's fine. They can complete it. We just need you guys to get it in the system. And then any comments you need to include here about that site that you want us to know on the IRB side. All right. And then the last thing you guys need to do with that is just say report complete. So what that lets you do is start the CR for each of your sites, but it's not done until you select that report complete. So now, if I go back into my CR, you can see that we have 1 of 1 sites confirmed. And they had total enrollment of 5. So we can update this number. Nope. Study-wide, 15. I really wish that it would update those numbers. And I actually have an enhancement request to the system to just do it. I think that's the one thing we all get wrong. Like everybody does this wrong, so like just add it. But yeah, so then you can save. And then I'll exit. And I'll hit submit. And that's it. So that's how you get your continuing review data into us. The rest of the workflow is the same. That's what you guys do. So it's different. I mean, it's just different from what you guys are used to doing. We're happy to help you the first time to do it. Really, if we can get more people there, you can stage, you wouldn't have them for that data.
So how does that affect, like you said, if you had one bad site then you've already submitted for the study, and they come back and now they say, oh, we did enroll 5 people. We can't go back and change what we've already submitted for the total study numbers.
Right. So I think, you know what, that's a great question. So I think along the way, right, every time the IRB sends the study back to you, your smart forms unlock again. And I think what I want to do is just test to see if there's another time point you can fit in. The tricky still, we might just have to do it, and it's updated. Because the other thing that's going to trigger the board to do is say, it's like, what's happening? Are you really in compliance? And they're technically out of compliance once you guys get approved and on. So then that might even trigger like, I've got to go down the road, like what's the problem? So, does that happen a lot to you guys that you're, okay, so, so no, I mean, I think there are ways that we can manage in the system, but I think we start to go down the non-compliance road if we're seeing that actor. And most importantly, what we can do with the IRB, we'll wind up suspending that site if they haven't submitted their review. So your study can remain active, but that site is suspended. And typically, the way that you have to resolve it.
So if you were submitting an RMI, for instance, participating site,
Yep.
having SAE that was reportable,
Mhm.
submitting the RMI under the study or under the site.
You can do it under the site. Yep. And for, when I think about it, I kind of like the idea of it being tied to the site because now you guys have the record and all of that is related to that site. And then if we have to make special determinations about that site, we can. And so I think any system in general really doesn't have that flexibility to say your study is still active. Like in the system, it could look like your entire study is suspended because you have a site that's suspended, not a study. This actually helps everything look right and compliant where it is compliant. All of your other sites are still active, and your study's still approved. Yeah.
So if you had a deviation in the site, you have to decide whether the deviation is the site's fault or it could be, in our case, we had RPI sort of do something that wasn't supposed to be on the site. Deviation. That would be a good study. We just did an operation in a slightly different way.
What did you guys decide? I'm actually kind of confused.
We just did the protocol. We just did the RNI. We had to do a retrospective.
Yeah, I
by the
mean,
site.
they are the lead PI. I mean, I would kind of say it's
It's the study thing. I didn't even know there was another option.
Well, I guess in your current system it wouldn't be, right? There isn't a study versus site record, so you would only have one option. Here, I would tend to say you could. I'll show you something neat though. Is if I report new information, and I'm in the site record, so right here it says we're in the site. So I'm just going to be really quick with this, sorry. So I became aware of this on Monday. What is this? You said it was a deviation, so I'll just say researcher error. I didn't, okay. Brief description. Lead PI did not follow protocol. What?
I said protocol that he wrote.
Okay, I'll do it. He wrote. There's no sass involved with that at all. New or increased risk? Probably not. Does the study need revision? Maybe he just needs to read the protocol. Does the consent document need revision? No. So here's what's neat, is that this ties it to both your study and the site. We have them there both. So we can't unlink them really, but we can take action against just the site if that's what's required. But what's neat here is that it's telling us that the lead PI did it, but the site was involved in the application. And that's important too, because if that impacted that patient, that would be the site's patient, not ours. So I think that's even helpful for us too.
Yeah, this one would really be the study because he had already done one. Just surgical condition that he hadn't foreseen when he wrote the protocol. So it turned out that it was okay to include this extra surgical condition
Oh,
He did
okay.
have to modify the protocol. He was already planning to do another one that way at a new site, so he had prospective. Publication.
Can happen in grade two. They're kind of in there and like, oh,
Yeah, they find out things
Yeah.
that were seen. It wasn't really anything bad in that case,
Yeah.
except that he did it without telling them.
yeah, there's the problem. Right, right. So yeah, I mean, I think, and then the other thing you can do here, just like you can tie it to any other studies. So sometimes I think of this as like, drug. You want to associate it with everything. So do that with the R and I. So you do have some options, and it will specifically call out your sites and the study. So. All right. Any other questions I can answer for you guys?